My name is Yolanda Jean, and this is a slideshow about the liver. The contents we will be talking about is the physiology, the identification, the anatomical location, images, common cancer, and lymphatic drainage for the liver. The anatomical location of the liver is the upper right-hand portion of the abdominal cavity beneath the diaphragm and on top of the stomach, right to the kidney and intestines. The liver is shaped like a cone. It is dark with a reddish-brown organ, and it weighs around 3 pounds. The liver holds 13% of the body's blood at any given moment. This is about 1 pint. The liver receives its blood supply from 2 separate sources: the hepatic artery, where it receives oxygenated blood from the general circulation, and the hepatic portal, where it receives deoxygenated blood, but it's packed with nutrients from the small intestine. This is the common hepatic artery, and this is the portal vein, right in here. The most common cancer for the liver, according to the American Cancer Society, is the hepatocellular carcinoma, HCC. It is the most common type of primary liver cancer. It occurs most often in people with chronic liver disease, such as cirrhosis caused by hepatitis B or hepatitis C infection. The risk of hepatocellular carcinoma is the most common type of liver cancer. It's higher in people with long-term liver disease. It is also higher if the liver is scarred by infection from hepatitis B or hepatitis C. Hepatocellular carcinoma is more common in people who drink large amounts of alcohol and who have an accumulation of fat in the liver. Signs and symptoms of liver disease may vary, but include skin and eyes that appear yellow and jaundice, abdominal pain and swelling, swelling in the legs and ankles, itchy skin, dark urine color, pale stool color, chronic fatigue, nausea, or vomiting. While the liver is located in the upper right of the abdomen, just below the ribs, liver pain can sometimes be severe and can cause a backache, and people can perceive it in pain in the right shoulder. The liver itself is a unique organ. It is able to replace damaged tissue with new cells. If 50 to 60% of the liver cells may be killed within 3 to 4 days of an extreme case, such as a Tylenol overdose, the liver will likely repair itself with 30 days if no complications arise. You can take one chunk or lobule of the liver and put it in a person with liver disease, and that chunk will begin to grow and regenerate. The lobes of the liver are 4. There's right, left, caudate, and quadrate. The right lobe is 5 to 6 times larger and tapers off the left lobe. The middle hepatic vein divides the liver into the right and left, or the right and left hemiliver. The falciform ligament divides the lobe into the medial segment 4 and segment 2 and 3. The caudate lobe is a functional part of both the right and left lobes because it receives blood supply from both the right and left arteries. The quadrate lobe receives blood supply from the left hepatic artery, and therefore it is a function of the left lobe. The liver is the largest internal organ, and you cannot live without your liver. The liver produces a large amount of lymph, which is estimated to be 25 to 50% of the lymph flowing through the thoracic duct. Lymphatic vessels in the liver function to retain fluid and regulate the immune system. Lymphatic drainage and the lymphatic vessels of the anterior aspect of the liver drain into the hepatic lymph node. These lie along the hepatic vessels and ducts in the lesser omentum and empty into the colic lymph nodes, which in turn drain into the cistern chyli. Lymph nodes on the posterior and anterior surface of the liver drain into the phrenic lymph nodes near the diaphragm and then into the posterior mediastinal lymph nodes before draining into the right lymphatic and thoracic ducts. Some of the main functions of the liver is it breaks down and stores nutrients absorbed from the intestine that your body needs to function. Nutrients are changed in the liver and metabolized, where they can be used for energy, to build or repair body tissues. Most of the clotting factors that keep you from bleeding too much when you are cut or injured are made in the liver. It delivers bile into the intestines to help absorb nutrients, especially fats. It breaks down alcohol, drugs, and toxic waste in the blood, which pass from the body through the urine and the stool. Here are some CT images of the liver. It's been outlined here. The liver is further broken down into two lobes, the right and left lobe, and then it's broken down into the quadrate and caudate. Here on this liver, it breaks the liver down into segments. You have your superior side here, the inferior side here. These are the surface areas of the liver. You have your posterior side on this side, which would be towards the back, as if you were looking from behind, and then the anterior side right here as if you're standing in front looking directly at it. Here's the liver. Here's the liver broken down into segments. The liver is further broken down into 8 segments. You have your right and left, your caudate, and your quadrate lobe, and then that's broken down even further. Then these 8 segments are broken down. These 8 segments are all broken down, and inside are even smaller little segments, and they're shaped like an octagon. In the center is where the blood connects to the hepatic nerve. Each corner has 3 nerves where it receives its blood supply. It's called the triage. And that concludes this segment.